My name is Lisa Armstrong. I'm an associate professor at the Craig Newmark Graduate School of Journalism, and this is a presentation on diversity and inclusion in pandemic reporting. So given the pandemic, journalists have had to change the way they report. One, because a lot of us can't get out into communities in the way that we used to. And two, because this is a story that is so widespread. It's something that changes day by day, and it affects different communities in different ways. But the same principles of diversity in reporting that applied before the pandemic, they apply here. So I put together a basic diversity checklist. One, are your experts and real people diverse? So make sure that whether it's top-down or bottom-up sources, that you are including diverse voices. Two, are you painting some groups as victims and others as heroes? When there's a disaster, or in this case a pandemic, there is a tendency to focus on a group of people. So often it's due to race or socioeconomics. So those people are the victims. And then there are others who are heroes. So make sure that you're not painting one group as all one thing all the time. Three, are you providing context and looking beyond biases? So we all need to be aware of our blind spots at all times, just in general in reporting, but especially now. And make sure that we're providing context. So if there is one group that has been more adversely impacted by the virus than another, you need to explain why. You can't just give the data. You need to actually go into why this is happening. Four, are you engaging with the community you're covering? This is something that you should be doing anyway, but you need to make sure that you are in constant contact with the people that you're covering and that you are building trust. And then five, are you really, really listening? This is something that has come up for me in reporting that I've done previously. I covered Haiti after the earthquake for several years. And you need to make sure that you're listening to community, because a lot of the stories that were coming out of Haiti at that time had the same narrative, that here's this country, it's the poorest country in the Western Hemisphere, and it's been impacted by this earthquake in a negative way. This is true, but there are stories that went beyond that. And a lot of the people that I talked to in the years that I was covering Haiti wanted journalists to look beyond that. And they had things that they either needed to share or information that they themselves needed, but they felt that people weren't really listening. So stories tend to focus on the mainstream. And there's some main things that you need to consider in doing this reporting. Whose stories are you telling? Whose stories are you missing? And who are you reaching and with what info? So for instance, when schools closed in New York, there were articles that kind of made the assumption that, I saw a lot of articles, sort of service stories about how to switch to online learning, how to set things up for your child's room so that they could best learn. And these stories made the assumption that people had enough computers, they had access to Wi-Fi, they had access to space that it would allow their children to learn in certain ways. Meanwhile, in my Facebook group, I live in Brooklyn, New York, there was a teacher who was saying that a lot of her students didn't have access to computers or iPads, and so they couldn't learn. So we need to, again, make sure that we're considering how different people are being impacted and make sure that we're telling their stories as well. And then the other thing that we need to make sure is that we're including a diverse range of faces. So even if it's something that is mainstream coverage, it's not something that focuses on a particular group, we need to ensure that we have diverse voices in those stories. And then we need to consider how people are receiving news, because people receive news in different ways, and make sure that the same vital information is reaching everybody. So while we need stories about COVID-19 that come from experts and top-down sources, we also need to make sure that we're reaching marginalized communities. So how do you do that? One, you can go through Facebook groups. As I mentioned before, I am in my neighborhood Facebook groups where there are a ton of story ideas because people are sharing what's going on for them personally. I'm also in Facebook groups for different geographic locations, and then I cover incarceration now, and so I'm in different incarceration-related Facebook groups. But the thing is, you also need to make sure that you're reaching people who might not be online. So how do you do that? You can go through advocacy organizations with existing networks, but you need to make sure that, or understand that they're going to put you in contact with people who share a particular narrative. If, say, you're highlighting the work that the organization is doing, they're going to probably put you in contact with people who say, yes, this organization is doing a good job. It's not necessarily a bad thing, but you need to make sure that you can reach people beyond them. So what I tend to do is if an organization puts me in contact with someone, I then ask that person, are there other people I can speak with? You can also go through religious organizations, ethnic restaurants. Basically, you're just looking for anybody who has roots in the community who can vouch for you and put you in contact with people. But the ideal is that you have already built these strong relationships within communities beforehand, because that, again, you've already built up the trust and it will allow you to more easily report. I was able to break this story about a death at Sing Sing Correctional Facility that people feared was from COVID-19, and he later, I confirmed with the medical examiner that the man who died tested positive for COVID-19. And I was able to do this story because I have contacts within Sing Sing. I know people who are incarcerated there. And actually the story came to me because one of those men wrote and said on the morning that Juan Mosquero, that's the man who died, wrote me about his death. And then I was able to reach out to other men at the facility. I also reached out to people at advocacy organizations with whom I had existing relationships. So they also were able to vouch for me. They put me in contact with men at other facilities and with family members. And so this is a story that I would not have been able to do as quickly had I not already had those existing relationships. So when it comes to reporting on COVID-19 and marginalized communities, it's important to consider whether the virus is going to have a greater or different impact on them than other communities. We should also think about what information the communities need, what's going on for them day to day, what they're getting, and what they're missing. And then we also want to make sure that we're telling stories of resilience. So again, there are some communities that are being more adversely affected, but that doesn't mean that there aren't stories within those communities where people are doing things to help. And when we're considering whose stories aren't being told, we need to think about across all spheres of diversity. So age, race, gender, socioeconomics, sexual identity. Just consider looking at national stories and thinking about how those issues might affect people in different communities. So select these two stories about how the coronavirus is affecting the trans community. One is from Vox, one is from Business Insider. And the first one from Vox followed the national stories about the record number of people applying for unemployment. And it raises a point that before the pandemic, trans people faced a greater level of workplace discrimination and issues with unemployment than cis people did. And so with the pandemic, obviously things are going to be a lot worse, and it goes into why. And then the second story follows a national story that was about how the Surgeon General was asking hospitals to delay elective surgery so that they could focus their efforts on treating people who'd been infected with the virus. And so this is by a male non-binary journalist, and he's talking about the fact that while this surgery might seem elective and it's something that could be postponed, his gender-affirming surgery isn't something that would be considered optional. It's something that actually, if it is delayed, would have a mental health impact on him and would have the same impact on others in his situation who are waiting for their gender-affirming surgery. So we also need to think about what information different groups need and why they aren't getting it. While structural racism is the reason that African Americans are getting COVID-19 and dying from the disease at a much higher rate than, say, white people, which is something that has been reported, it's also in part due to information. So I had seen stories on the news of people who said they'd seen stories before or they'd heard on social media that Black people couldn't get COVID-19. I actually am in a Facebook group. I spent the last 2 years of high school in Jamaica, and I'm in a Facebook group for my class reunion. And within that group, people were sharing stories about ways you could, things you could take so that you wouldn't get COVID-19, or just other kinds of misinformation. And so you need to make sure that, again, people are getting the information that they need. Now, there are several barriers to this in some cases. One, people from certain marginalized communities may distrust journalists, so it's important to build up trust. You need to prove yourself a reliable source of information who also understands the community's needs. Again, this is something that you would ideally have done before but it is something that you might need to do, again, by going back over and over, keeping in contact with people and asking what they need. You should also think about where else stories are being shared, because people are getting news on WhatsApp, through newsletters, etc. And one example is Patrice Peck. She started a newsletter called Coronavirus News for Black Folks. It's a weekly newsletter. It's something that is, I mean, she initially has started producing the content, but it's going to be something for Black folks, with content created by Black folks, to look at the gaps in coverage that she felt were there, that, you know, there wasn't really enough about how the disease was specifically impacting physical, mental health, social and cultural structures and institutions and other things. The other thing that you need to make sure to do is to add context even to headlines, because a lot of people will see things, for instance, on social media, they'll see the story, they'll look at the headline, they won't actually click on the story. So again, as I mentioned, there have been several articles about the fact that African Americans are dying from COVID-19 at a higher rate than people of other races. This is often due to underlying health issues, but that's in turn a result of racist policies. So don't just give the stats, you can give some context even in headlines. So we have a headline here that just basically says all St. Louis COVID-19 deaths have been African Americans. Fine, it's facts, it's information, but it doesn't really provide context. And then we have this other headline that says how racism and poverty made Detroit a new coronavirus hotspot, which gets into the underlying issues and gives the context. And in terms of how people are portrayed, who are the heroes and who are the victims in this narrative? So immigration status is something that, again, is an important issue to look at in terms of how people are being impacted by COVID-19. If you're undocumented, for instance, you might get sick and not want to seek medical treatment. If there are people in detention facilities, once the virus is in those facilities, it is something that will spread and there's really no escape. So these are important stories that point to real issues that should be covered. But they paint undocumented people in the same way that we often see them in mainstream media. So we see them in detention facilities, we see them as farm workers. You know, there's a story here about farm workers who are mostly undocumented, who are basically being forced to continue working because they are harvesting the food that everybody else in the country is eating. So it's important to look at other narratives as well. The story from the Washington Post focuses on dreamers who are risking their lives. So in this case, they are the heroes. They are the healthcare workers who are working to save people as they wait for a decision about their own futures. And so it's important, again, that there's the young man who's in the photograph who is a medical resident. It's important to, again, portray people in different ways so that we're not seeing them all as one thing. And then finally, we want to make sure that in terms of biases, we think about the language that we're using. So the obvious one is, you know, make sure that you're referring to the novel coronavirus or COVID-19 rather than linking it to Wuhan or China. But there are other more subtle ways in which bias seeps in. So this story is about how 5 countries are basically saying that the US has blocked their access to getting medical equipment that they need to combat COVID-19. And the 5 countries include Germany, France, and Barbados. And in this case, Barbados is the poor Caribbean island that's referred to in the headline. And the question is, why mention that? I guess the point being that poor Barbados won't be able to help themselves, whereas maybe Germany and France can. But it's a case of bias. The question is, what makes Barbados poor? Is it even a poor island considered its GDP per capita, which is actually the 2nd highest for the region? And why mention it in the headline? Like, what is the point that you're trying to make? So finally, some takeaways. One, again, we're considering how the pandemic is affecting different communities and making sure that we are listening to them rather than making assumptions in terms of how it's impacting them. 2, do the work to find diverse sources. Again, this is something that ideally you've done before, but you really need to make sure that you're putting in the effort to do that now. 3, be mindful as always of language choice and how certain communities are portrayed. And then finally, be empathetic and listen. I think that's probably one of the most important things here, is to listen, to hear people's stories, to understand how they're being impacted, and then to also recognize that we are all being negatively impacted in some way by the coronavirus. We are all, I think, for the most part, overwhelmed. And so be aware of that as you're talking to people. Try to reach them where they are and in ways that are easiest for them. I, for instance, generally prefer to do in-person interviews or at least over the phone, but I've had to do interviews with people where I send them the questions by WhatsApp or I send them questions by email because that's the easiest way for them to answer them. So make sure that you are listening and that you are being mindful of the community's needs. So thank you very much. I appreciate you listening.